overall, and for funding. And so we had a lot of contact with them. And you wouldn't be surprised to know that in 2002, as today, there were concerns about whether A&E could cope. And there's nothing new in this case, except that our Lewisham Primary Care Trust, when it was talking about University Hospital Lewisham, which was where the bulk of our money went, it determined that Lewisham Hospital had a case for survival. It's a large about draws from, and there are not many other good hospitals around. So we knew that whatever we were doing in 2002, we would be ensuring that the hospital survived through it to become bigger and better. And on that basis, we agreed with them that they wanted to get a grant, a PFI contract, I dare say.
There had been a previous inquiry where the so-called a picture of health for South East London, where they had looked at where patients would go if there was no A&E in Lewisham. And all of the modelling that they showed pointed out that patients would, in order to take advantage of the public transport links, would have to go more centrally. They would need to go to places like King's, they would possibly go to St. Thomas's. That's where all of the links are. However, the TSA seems to take an opposite view, that people would easily be able to go to Queen Elizabeth Hospital, Woolwich. My understanding is that they believe that that would only involve a journey of, on average, 1 minute more. I think the people's personal understanding of that, and sorry to cite YouTube links, might beg to differ.
The day which my father called the day of freedom. It was the day he no longer had to ask patients to pay for coming to see him with their illnesses. He remembered the 20s and the 30s, the fragmented healthcare service, hospitals, voluntary, run by local authorities, private, a healthcare system which was not matching the needs of patients, having private patients. There were one exception, and that were the local gypsies, who refused to think they'd had a real consultation unless silver crossed the palm. But when we look back, we can also look forward.
Right, could you give us your names, please?
I'm Sally Stevenson.
I'm Dion Stevenson.
And in what capacity have you come here today to give evidence to this inquiry?
I'm here as a parent, Dion's here as a patient.
Okay.
My eldest son was born with a really rare syndrome, and he used probably every department in Lewisham Hospital and with the healthcare system. He had a progressive illness, sadly passed away 7 years ago, but in that time we used Lewisham Healthcare a lot, and at one point he, because he had a self-injury problem, we were down in the A&E every week, probably 2 or 3 times a week from school and from home, so we well used the services.
And what about now? How do you rely on the services now?
We rely on it quite a lot. Dion has quite complex needs. He sees OTs, physios, paediatricians, the speech and language therapists, dietitians, got gastrostomy. So he uses a lot of the services still. What do you think, Dion?
Yeah, I have to use a lot of that stuff because it's important, and let's face it, right, if Lewisham gets closed down, King's College.
Can you tell us about why it's important for you to be close to Lewisham Hospital?
Because we need to be able to get somewhere quickly. It's not even just about being close to the hospital, it's when you're in the community and when you live close to a hospital. The same people you see in the community, you see in the hospital. So it's the same, it's the continuity of care. So we know the doctors, we've got trust in the doctors. If Dion's ill, I can ring his doctors and everything is seen. And I'm 2 minutes away. If I need to get Dion to the hospital quickly and I'm 2 minutes away, that's fine. If I've got to do an hour's journey, it's going to be impossible to do that with a child that's unwell and could deteriorate. So we live close, we live walking distance if we have to be. Parking's an issue at lots of hospitals, especially King's. So if we have to walk it, we can walk it. We know the doctors now, the doctors know Dion, and if we've got to go somewhere else, we've got to start up relationships all over again. And also, if I do have an emergency, then I'm a long way away, and it's taken away a safety net really. Having somewhere close is like what makes you feel safe and secure, and knowing the doctors as well, but being close by matters a lot. What about you, Dick?
If you don't know the doctors, then how are they meant to know if you're not well or if it's serious or not? How can they judge if you don't know them?
And how do you get on with the doctors that you work with and that help you at the moment, and any particular doctors?
It's basically like trust. That's all it is. You just trust them. That's how they know you. That's how they know what they're saying is right because you know them.
The last thing I worry about when I'm rushing my children to hospital is whether or not it's going to stretch NHS resources. We do our jobs as parents, we look after our children, we make sure they're well, we do what needs to be done. So he should do his job and make sure that they've got adequate and close by healthcare should we need it.
And Dion, is there anything you want to say?
You just need a reality check.